Right. Hi, Dr.
Yes,
Rogers.
good to see you.
Good to see you.
Go and have a seat there.
Thanks so much.
Sorry about last week in the OR. I didn't mean to cut you off. I was definitely interested to talk about your knee. I was just so slammed with those patients.
Oh, not
It's
a
kinda
problem.
crazy.
I know you're an extremely busy person, which is exactly why I only want to take just a few moments of your time today. We'll run through this pretty quickly.
Okay.
What I want to do is just go over the Journey 2 product. That's what we've been talking about from Smith & Nephew. But first and foremost, I kind of want to just lay out what my goal is today, and that is to be, just kind of a wealth of information for you as far as, like what products are out on the market, what some of our competitor products are, maybe even some of the newer techniques being used. So I've done a lot of research and studies, things like that, but you're the surgeon, you're the one that's going to get your hands on these.
Sure.
So I want to make sure that, you like it and that you think it's going to be a good fit for you and your patients.
Perfect.
So, first off, I know one of the best things about my job is that I get to come in here and talk to you a little bit about what goes on in your practice, specifically in consultations with your patients, things that I don't get to see in the hospital every day. So as we go through this, is it okay if I just ask you some general questions
Sure.
about those things?
No problem.
Okay, so just to start, I know you've been in business, here in Denver, 15 years, something like that?
It's almost 20 now.
Wow, I mean, congratulations, that's
Thank
a
you.
huge accomplishment. So one question I have for you is just kind of what changes are you seeing in your practice as far as, maybe patient demographics, things like that?
Well, in Denver, as you know, we have a much younger population anyways, that people are out here. But I think the two major differences now is we're getting a much younger population that's requiring knee replacement. And we're certainly seeing a much larger population.
Uh-huh.
In fact, maybe that's even more problematic than our younger population now. We get a lot of people that are significantly overweight, the BMIs are off the charts. Right. And I think that's wearing out these joints a lot quicker.
Sure.
And so, my goal, of course, is not to operate at all. I'm a big believer in joint preservation.
Mm-hmm.
I'm a DO, so being a doctor of osteopathic medicine versus the MD, I'd rather preserve the joint if I can.
Absolutely.
But once we get bone on bone, unfortunately, we have no choice. We're going to cut it.
Right. So it's funny you mentioned kind of the younger population. Mm-hmm. I was reading a study the other day in the JBJS that showed that over half of the patients now requiring a total knee are actually 65 years old or younger. So, that's pretty shocking.
Yeah.
So let's just, come up with a scenario here. Say you have a patient that comes in 45 years old that has developed some pretty severe osteoarthritis in his knee. What would you say are maybe top 3 concerns that he has with regards to getting his knee operated on?
Well, I think, with especially the younger population, most of them have to work, right? They're not all independently wealthy.
Mm-hmm.
And depending on the progression of the disease, it may be to the point to where they're some sort of short-term disability. So if they can't go to work, I think their big concerns are, is this thing going to get me back to work?
Mm-hmm.
Now, granted, anybody that's bone on bone, pain's always going to be, I think, the number one concern.
Sure.
Is the relief of pain, but obviously being back to work is going to be one.
Mm-hmm.
Recovery time. What's going to be recovery time if I go into the night? Because if they are currently working and they're kind of working through this pain, they don't want to lose their jobs.
Mm-hmm.
And then I think lastly, anybody wants to know, is this a short-term solution,
Mm-hmm.
for this pain relief, or is this a long-term, viable strategy to remove it forever?
Right.
Is it going to last? Is it going to be something that, they're going to be back in, often for revisions, or is this something that's going to fix the problem? So
Mm-hmm.
I think all those things kind of play factors.
Absolutely. So, just talking about longevity in particular, what would you tell them as far as how long their knee is typically going to last?
Well, and I think you can see the research studies, and in fact, at the latest conference that I just attended, they're all touting 15, 20 years, but, appears to be the right number.
Mm-hmm.
I think there's most studies, I just read a study in JBS just the other day that said I think it was 12.5%, 90-some% survivorship, I'm not sure what it was, and I think that's probably in line.
Yeah.
So I tell most of my patients, 15 to 20 is where we're at.
Mm-hmm. I think I read the same study, average life 12 and a half years for a total knee. So let's say, we take this patient that we were talking about that's 45 years old. The likelihood that they're probably going to need a revision by the age of 60 even is probably pretty high. So that's something, you just mentioned, you don't like to do revisions.
Right, no, I don't think any of us like to do revisions.
Exactly,
right.
So at Smith & Nephew, one of our goals is really, for those number of revisions to stay down. We don't want you, our surgeon customers to have to do that. So that's why we've developed the Journey 2. So if you want to go ahead and take a look at that. What you're going to see on that is the black femoral component.
Yeah, I see that.
What that is our oxinium, and oxinium is oxidized zirconium, which is an extremely wearable material. It's more than twice as hard as cobalt chrome, 4,900 times more resistant to abrasion than cobalt chrome. And that oxinium in combination with our highly cross-linked polyethylene makes what we call Verilast. And our Verilast technology, we actually got approved by the FDA to be able to market that to towards a 30-year wearable technology. So these implants, therefore, are going to address the needs of your younger patients that need something that lasts a little bit longer.
Okay.
Next thing I want to talk about is gender in regards to your patients. So can you tell me what you're seeing as far as patient population and gender? More females, males?
Well, I think with regards to gender, and I think most surgeons would say the same thing. We tend to see more female patients than males.
Right.
Both bone quality and some other factors in there. So I'd say it's probably 60% female, 40% male.
Okay, great. And I know sizing can obviously be kind of an issue with females, but what would you say are maybe 3 of your other top concerns as a surgeon when it comes to operating on a female?
Well, certainly sizing is going to be one. Good fixation principles. Their bone quality isn't the same, so I want something that I can feel confident if I don't cement it in that I'm going to get some good bone purchase and get that bony and growth on growth through some of the new metals that are out there.
Mm-hmm.
Outside of that, clearly there's some issues. If you look at the longer term data where patients are having problems post-op, some of it's attributed to this metal reaction,
Mm-hmm.
these metal allergies that tend to be problematic. So in a female, they're more susceptible to that, and I think that kind of plays a role for some surgeons as they consider replacement for a female patient.
Absolutely. I was actually reading a study that was talking just about that the other day, led by Dr. Kuroshi. Nickel is the most frequent common metal allergen, specifically in females. So, what we've done at Smith & Nephew is essentially just we took the nickel out of the oxidized zirconium that we're using. So, therefore you as a surgeon, you're going to have, the confidence that your patients aren't going to have a bad reaction to this material, because the oxidized zirconium that we use actually has only 0.0035% of nickel in it. So,
Okay.
Once again, you're going to be able to put this implant in and rest assured that you're not going to have to take it out and replace it with something else. So I told you I was going to just take a little bit of your time today. So now I would just kind of like to summarize what we talked about. First thing being that you are seeing a lot of younger patients now requiring longer term implants. So I hope I've been able to accomplish my goal of explaining to you how the oxidized zirconium is really going to help with that and provide exceptional, wear performance.
Right.
Additionally, we talked about gender and how your female patients have, metal sensitivities. By taking the nickel out of this material, I think we've accomplished, solving that problem for you pretty much as well. One last thing to mention is that this implant does come in 10 different sizes. If you choose to use it, we can definitely do some templating before each and every one of your cases to make sure we're getting the best fit for all of your patients. But last question I have for you is just kind of where do you want to go from here? Would you like to do a cadaveric lab? Do you want to actually get your hands on in the OR? Can we schedule a case?
Well, I'm definitely interested. That's why I was interested in the material as I saw it at the show, as I told you the OR the other day. I'm definitely interested in trying this implant out. I'm not a big fan of trying it out on patients. So if you have a lab that's local, I don't really want to fly, but if you got a lab that's local, I'll be more than happy to attend.
Sure.
If you don't, I'll do sawbones and I probably get just as much out of that.
Okay.
So just talk to Kim on the way out, see what my schedule is.
Perfect.
Let's book some time and we'll kind of move forward from there.
I'll do that. Thank you very much, Dr. Roberts.
Appreciate it. Thank you.